The treatment of pulmonary thromboembolism consists of the use of anticoagulants, fibrolytic therapy in selected cases, embolectomy, and the insertion of an inferior vena cava filter. DTPA, streptokinase, and urokinase have been utilized for the destruction of thrombi. DTPA is one of the most popular agents, and it can be either systemically utilized or directly applied proximally to the occluded. Anticoagulation. In acute situations, the use of intravenous heparin is the prime modality to be utilized. The objective is to prevent the progression of the thrombotic process. Long-term anticoagulation consists of the use by mouth of warfarin, and the objective is to prevent the progression and induce a regression of deep venous thrombosis. Embolectomy is performed for large thrombi in proximal pulmonary arteries. There are two types of embolectomy: catheter embolectomy, which is infrequently utilized, and surgical embolectomy, usually preceded by angioscopy. If the embolus cannot be removed, we recommend fragmentation of proximal thrombi into smaller fragments that, when dispersed through the lungs, will improve the hemodynamics. When a source of pulmonary thromboembolism is found in veins of the lower extremities, particularly the cava, an inferior vena cava filter can be placed percutaneously through the right internal jugular vein and advance below the level of the renal veins, which is about the level of L2. And this is a filter that can be utilized to interrupt the thrombi ascending into the pulmonary circulation from the distal cava, the iliac veins, or the veins of the lower extremities. Inferior vena cava filters are often inserted via the right internal jugular vein. One can also utilize the right femoral vein approach. Prior to the insertion of the filter, one must clear the external iliac, common iliac vein and the inferior vena cava from thrombi. If there are thrombi in these vessels, it is complicated to proceed via the femoral vein. When the iliac veins on the right side and the cava are cleared, a catheter is inserted, and the right renal vein origin is identified. The next step is to insert the filter, which should be placed distal to the entrance of the renal veins. Otherwise, thrombosis of the renal vein may follow the inferior vena cava filter insertion. One lastly injects contrast material and demonstrates the correct position and appearance of the filter in the inferior vena cava.